My name is Holly Swiger. I'm a nurse by training and have been working in the hospice industry for over 26 years now. It gives me great pleasure to have been invited here by misocare.org, and I'm so happy to share a little bit today about hospice and how it might be helpful for you, your loved ones, your patients, etc. So just so you know a little bit about my background, I was a nurse. I've worked in inpatient care, long-term care, home health, and then when I found hospice in San Diego some 26 years ago, I really felt like I'd come home. It was the first time that it kind of mirrored what I thought I would be doing in nursing. In other words, it looked at the physical, the psychosocial, the spiritual aspects of the patient, and we were able to provide most of that care in a person's home, where they really wanted to be. So I did inpatient hospice care. I developed San Diego Hospice's inpatient hospice. I served on the National Hospice and Palliative Care Organization's board for 8 years. I was a founding board member for the California Hospice Association, and now work with many other hospices. I'm the Vice President of Public Affairs for Vitas, and in my job that I've had for 15 years now, I now do more regulatory and legislative work on behalf of the hospice industry. Not only do I assist our programs in developing hospice, but I also work with state organizations and the National Hospice Organization in making sure that we remove barriers so that we can more easily provide hospice care to those that so need it. Now, what helps me a lot is to find out who's in the audience. Do I have any physicians or physician assistants here? Okay, nurses, all right, social workers. How about chaplains? Volunteers? Anybody that might be facing a life-threatening illness? Okay. And then how about someone that might have lost a loved one to a terminal illness? Lots of hands, yeah. So for those of you that said that you were professionals in the delivery of health care, how many of you, raise your hands, how many of you actually were trained in how to take care of somebody who was dying? Yeah, I see very few hands going up. Well, my story, I remember when I first went into nursing and was doing floor work, was that if I found out that someone in room 304 was dying or close to dying, I really hoped and prayed it wasn't on my shift. I was so poorly prepared in knowing how to deal with these, patients and their families, how to talk with them, what to do. And that's what we find out, is that people who have terminal illnesses in hospitals frequently have less contacts by staff or in nursing homes because we've not been trained well. But guess what? Research has shown that the mortality rate in the United States is 100%. Did you know that? Yes, especially as professionals, and even if we're not in healthcare, we are all going to have to face death. So let's look a little bit about how people are dying in America and talk about that. Today, I really want to go over what is hospice care, how it differs from palliative care, its history, the philosophy, the list of criteria to make hospice, of when it is appropriate for hospice care and what kind of diseases do we treat and work with. And then I want to provide time at the end to answer some of your questions. But most importantly, I want you to understand what an incredible value hospice is for someone that's having to face the end of life, and how that healing can really continue to happen at this most intimate time, and that hope doesn't go away with a terminal illness. It's just transformed. And hopefully through some of the stories, I'm a storyteller, through some of the stories I'll share this evening, you'll get a better grasp of that as well. So how was dying in the 19th century? Well, 3% of Americans were over 65 years of age. Why? Because the life expectancy was 45 to 50 years. Most people died at home from an infection or a sudden issue, and their dying process was fairly rapid. An interesting bit of trivia is where the word funeral parlor came from. Well, most people, when they died at home, were laid out in the parlor. And not only was that a place for people to come and say their goodbyes, but frequently the funeral was held there. So interesting how we've kind of kept hold of those words. Well, what is it like in the United States today? Well, 13% of the population is now over 65 years of age, and 75% of Americans die in healthcare facilities. A big change. 57% in hospitals and 17% in long-term care facilities. Yet when asked, 9 out of 10 respondents cite their home still as their preferred site of care. I mean, if you've ever been away from home, and even me right now in a hotel, I bring my pillow. I want the comforts of home, and that's why hospice care really helps facilitate that need by keeping people home where they want to be. Well, I know growing up we always say, well, if we have to go, I want it to be quick. And my uncle, bless his heart, had that opportunity, I guess one would say. He died just silently in his sleep one night. But I have to tell you that after getting involved in hospice care and realizing that, first of all, over 90% die from protracted life-threatening illnesses, whether that be from cancer or congestive heart failure or others, I have found that there's some pretty amazing things that can happen when you have the knowledge that you have a terminal illness. Okay, look what's happening to the population of 85 and older. As you can see, the numbers are growing tremendously. It's the fastest growing segment in our population. In fact, right now, 1/3 of hospice patients are older than 85. Currently, today, we have 100,000 centenarians in the country, but by the year 2025, that number is going to reach 2 million. Obviously, there's an increased need for good palliative and hospice care.